Marijuana has been used for its healing properties for thousands of years, but only recently has scientific research begun to unlock and confirm its medical potential. Long stigmatized as an illicit drug, cannabis is now gaining widespread acceptance as a legitimate medicine. Medical marijuana is currently legal in some form in the majority of U.S. states and countries around the world. However, the plant remains controversial due to its psychoactive effects and classification as a Schedule I drug. Still, public support for medical marijuana legalization continues to grow as new research emerges. How marijuana affects the body and brain. Marijuana produces its therapeutic effects through a network of chemical compounds called cannabinoids. The cannabis plant contains over 100 different cannabinoids, each with its own medicinal properties. The most well-known are THC and CBD. THC, or tetrahydrocannabinol, is the main psychoactive compound responsible for the high associated with marijuana. CBD, or cannabidiol, does not produce psychoactive effects but has anti-inflammatory, analgesic, anti-anxiety, and anti-seizure benefits. These cannabinoids interact with the endocannabinoid system, a complex cell signaling system in the human body. The endocannabinoid system consists of endocannabinoids produced within the body as well as cannabinoid receptors located throughout the central and peripheral nervous systems. When phytocannabinoid from the marijuana plant are introduced into the body, they bind with these cannabinoid receptors to produce medical effects. There are two main types of cannabinoid receptors. CB1 receptors are concentrated in the brain and central nervous system but are also found in various organs and tissues. THC binds with CB1 receptors, explaining its psychoactive properties. CB2 receptors are located primarily in the immune system and peripheral nervous system, making them important targets for treating pain and inflammation. In the brain, cannabinoids influence regions involved in regulating pain, memory, mood, movement, and more. They can modulate neurotransmitter release, reducing excess dopamine activity during psychosis while elevating deficient dopamine levels in Parkinson's patients. Cannabinoids also decrease inflammation in the brain, providing neuroprotective effects that may slow the progression of Alzheimer's and autoimmune diseases like multiple sclerosis. Outside the brain, cannabinoids relax muscles, relieve pain, stimulate appetite, and more. Cannabis has demonstrated the ability to reduce intraocular pressure in glaucoma patients and gastrointestinal inflammation in patients with Crohn's disease. The wide-ranging medical potential of marijuana stems from the endocannabinoid system's role in maintaining homeostasis and modulating basic biological functions throughout the body. Marijuana for chronic pain relief. Chronic pain affects over 50 million Americans, making it one of the most common reasons patients seek medical marijuana. Cannabinoids interact with pain pathways in both the brain and body to provide analgesic effects. While not as potent as opioids, marijuana offers a much wider therapeutic window and lower risk of overdose or addiction. Studies show cannabis is effective at treating neuropathic pain, or nerve pain, as well as chronic pain from arthritis, fibromyalgia, multiple sclerosis, and spinal cord injuries. A meta-analysis of 28 randomized controlled trials found a 30% reduction in pain scores among chronic pain patients using cannabis. Marijuana for neurological disorders. Research shows cannabinoids have neuroprotective and anti-inflammatory properties that may benefit patients with certain neurological conditions. Marijuana can help manage symptoms like pain, muscle spasms, and tremors associated with these disorders. Multiple sclerosis. Multiple sclerosis, MS, involves damage to the myelin coating around nerve fibers. This disrupts nerve signaling, causing pain, muscle spasms, and loss of coordination. Studies indicate cannabis reduces inflammation and nerve pain in MS patients. In clinical trials, an oral spray containing THC and CBD decreased spasticity and pain scores by 30–40%. Marijuana may also help with bladder control, numbness, and sleep quality in MS. Epilepsy. Several cannabinoids have anticonvulsant effects. Epidiolex, a pharmaceutical CBD extract, reduced seizures by 40–50% in clinical trials for Dravet and Lennox-Gastaut syndromes. These severe childhood epilepsy disorders are resistant to other medications. THC also shows anti-seizure activity. Parkinson's disease. Parkinson's disease involves the loss of dopamine-producing neurons. Motor symptoms like tremors, stiffness, and slow movements relate to dopamine deficiency. Research shows cannabinoids modulate dopamine levels and improve motor function in Parkinson's patients. Marijuana may aid sleep and depression as well. Alzheimer's disease. In animal models, THC and CBD decreased Alzheimer's-related inflammation, oxidative stress, and plaque buildup. However, human trials are still limited. Small studies suggest cannabis may slow disease progression and alleviate agitation in Alzheimer's patients. More research is needed. While marijuana shows promise for these neurological conditions, patients should consult their doctor for guidance. Proper dosing and delivery methods can optimize benefits while minimizing cognitive side effects. Further studies will uncover the full potential of harnessing the endocannabinoid system to treat neurological disorders.